Hi, I'm a program coordinator with the Upper Midwest Telehealth Resource Center, a program of the Indiana Rural Health Association. And today we're going to go over some updates related to telehealth coverage in the region for the second quarter of 2023. We'll be covering the basics of Michigan Medicaid, updates to Michigan Medicaid post-public health emergency, as well as some pending legislation in Michigan as of March 2023. If you have questions related to the contents of this video, please reach out to us at info@umtrc.org. First, we'll look at some basic information about Michigan Medicaid. As of July 2022, nearly 3 million Michiganders were enrolled in Michigan Medicaid and CHIP. Michigan Medicaid is housed under the Michigan Department of Health and Human Services, MDHHS. They should be contacted with specific questions about Medicaid coverage in Michigan. One thing to note about Michigan Medicaid is that the term telemedicine is used in all documents and coverage related rather than telehealth. Despite that, the meaning is more or less synonymous. Now we'll touch on automatic enrollment changes. Due to the upcoming end of the public health emergency, federal legislation has dictated an end to automatic enrollment, and certain eligibility considerations changed due to COVID-19 PHE. Medicaid beneficiaries will have to renew their coverage this year, starting in June, as Michigan resumes Medicaid eligibility redeterminations to comply with federal legislation. Renewals for traditional Medicaid and the Healthy Michigan Plan will take place monthly, starting in June 2023 and run through May 2024. Monthly renewal notices will be sent 3 months prior to a beneficiary's renewal date, starting with June renewal dates. Beneficiaries can check their renewal month at michigan.gov/MIBridges. On March 2nd, 2023, Michigan Medicaid released a helpful bulletin that was created to update program coverage of telemedicine services after the conclusion of the federal COVID-19 public health emergency, and to clarify which bulletins are now discontinued as of the date indicated, which is May 12, 2023, the end of the public health emergency. I won't be going over the entire bulletin here, though I would recommend you consult it if you do practice Medicaid in Michigan. But some of the important highlights are as follows. So, general telemedicine policies. Michigan Medicaid has established telemedicine service principles for determination of telemedicine use, and these include the provision of effectual service, considering improved and appropriate access, making appropriate beneficiary choices, employing appropriate utilization, and ensuring positive value considerations. These should be considered when providing Michigan Medicaid via telehealth going forward. Determination of appropriateness and documentation. Michigan Medicaid dictates that in-person visits are the preferred method of service delivery, and that telehealth should be a complement to these services and not a replacement. All telemedicine services must meet all the quality and specifications as would be if performed in person, with an in-person follow-up scheduled if the goals of the appointment are not met via telehealth. Prior authorization. According to this bulletin, no prior authorization is required for fee-for-service beneficiaries or those accessing behavioral health services through prepaid inpatient health plans or community mental health service programs, unless the equivalent in-person service also requires prior authorization. Some additional highlights covered in the bulletin include telemedicine reimbursement or payment parity. The effect at the end of the public health emergency is that the reimbursement rate for allowable telemedicine services will be the same or at parity as in-person services. It's important to note at this time, payment parity for telehealth services only applies to Medicaid, but Michigan is in the midst of a larger movement towards payment parity as a state, so this is something to keep in mind going forward. Audio only. Preference is given to traditional video visits with audio and visual components, but if not available, MDHHS will allow audio-only coverage for certain telehealth services. You can see the bulletin for a list of full codes. This includes primarily behavioral health visits. Billing requirements. all telemedicine visits are required to ascribe to correct coding requirements equivalent to in-person services, including ensuring that all aspects of the code build are performed during the visit. Like I said, this isn't the entire contents of the bulletin, but these are some of the important highlights. Now to briefly go over private payer. The largest private insurer in Michigan is Blue Cross Blue Shield. Questions about private insurer coverage after the public health emergency should be addressed directly to the insurer, as answers will vary depending on the state, type of coverage, and service being discussed. Now to talk a little bit about pending legislation. There are numerous pieces of pending legislation related to telehealth in Michigan. A full list of these can be found on the Center for Connected Health Policy's legislation tracker. A few that have either been introduced or have had movement very recently are listed here. House Bill 4213 would, among other things, require coverage of telehealth in the Medicaid program, including adding language that would allow for audio only and telehealth to be an eligible encounter for FQHCs and RHCs. HB 4169 is a bill to enact the Occupational Therapist Licensure Compact. HB 4131 will update the state's private payer laws and require, among other things, that there be payment parity, and that health plans not limit telehealth delivered services to only be provided via a third-party entity. As I said earlier, payment parity for telehealth services is a growing initiative in Michigan and should be kept in mind going forward. A few events and resources to keep in mind for Michigan are the PRISM Telemental Toolkit provided by Central Michigan University, which goes over how to prevent suicide in Michigan men using telehealth as a resource, as well as the 26th Annual Michigan Rural Health Conference occurring on April 27th and 28th. This year, the Upper Midwest Telehealth Resource Center will be sponsoring a track at the Indiana Rural Health Association's annual conference in June on the 13th and 14th. Please register today to connect with other telehealth professionals and to see some great presentations about trending telehealth topics such as RPM and AI. You can visit our website at umtrc.org for more information. If you have more questions, please reach out to us via email at info@umtrc.org or connect with us on social media. Stay connected with the Upper Midwest Telehealth Resource Center for all the latest in telehealth news and telehealth updates.